3 straight lines, yeah? 2 down the side, straight line up the middle. Lift legs up and down 3 times to move compensation patterns. Make sure everything is lined up straight. Look from kind of the calves, back of the knees, up the body. Do not look at the feet. Everything straight, dorsiflex, look down, look back up. Yeah, so looking down then looking back up straight away creates a snapshot, allows you to see the difference without staring, and then you kind of change and confuse yourself. Quick snapshot, come back up, and you'll know straight away that there's a slight short leg on the right side. We go up, and then it's level, which means, okay, positive Derifield screening, good audience participation there. So we're looking at a Coccyx sacral thing. Let's check the neck. So can you rotate your head one way for me, please, Will? No change. And the other way? No change. Okay. So basically, the neck is screening as not being involved because nothing has changed on the screening on neck rotation. Yeah. Okay. So then we will go and start work on the body. So hands will be in assessment mode. So basically all the moves we're doing, primarily we're feeling the tissues to understand where the lines of tension are and where the restrictions are within the body. A little bit of slack. Give it a moment to let the body start to release and then move over. Same on the other side. Good. This side is tighter, which fits with the short leg, which is good. Working on the glutes. So kind of 2 fingers above the top of the bum crack, going over to where the glutes are. Again, the line from the trochanter up to the top of the pelvic crest on the PSIS. A bit of slack, so you go underneath the muscle, then pressure over the top and roll over. There we go. Move to the head of the hamstrings. Push down to block the signal that I'm going to create here and to keep the release within the hamstrings. So pressure's on the head of the hamstrings, and then I just like pull up a bit so I have a really firm contact. Kind of move the thumb to the top of that little tendon, because you want to drop off that tendon to the nerve that's just underneath it. So you're kind of not moving over the tendon, but you can use the tendon as a marker so you know you're in the right place. And go to the ITB, underneath it, lift up and over. Peroneus longus, which I'll show you in this, but we'll do it properly later on in the course. Ooh. Twang. And then by the ankle where it attaches. Cool, and then we will repeat all that on side 2, the B side. Okay. So, glutes, what I call neural hamstrings, so pin, basically blocking the signal, hitting the nerve, down to the ITB, onto peroneus longus, done. Okay. Now we're going to move up to the mid back. Use the inferior angle of the scapula as your bony reference. Straight across the middle, so it's kind of around where about the bra strap is. It's kind of T7-ish level. Exactly the same. Fingers and thumbs slightly offset. Cross fibre stimulation. Medial border of the scapula, so we want to work on the rhomboids within that area. So kind of about halfway point. Skin slack down, put the pressure on, roll up, pull down, roll up, all the way up, covering all those muscle groups, and then down over the top of the upper traps. Come down to the teres. Again, the point of the scapula here and the top of the shoulder is a good landmark. It's going to run down there, so you want to be in the middle. Under for the lats. Lats feel really fine and loose. There's a bit of tension there. There's a little bit of tension in the middle. So all this is about really assessing the tension, changing tissues. This all feels absolutely fine, like I've got nothing in the world to worry about on this bit. A little bit tight, but nothing drastic. Same in there. Okay? So that starts everything off. You can, at this point, leave for a couple of minutes, let things settle, come back, do it all again. As in, you can reassess and see how the tissues have changed, where the tight bits were, how they've responded, etc., etc. So we won't do it all over again, so we've done that. It's just, and then looking at sort of like the mid-back release. So just bow and move. So basically, you've got where your stoppers were, here and here, and we're going to work in the middle. It's exactly the same. Feels a bit tight on that side. Okay, all right. Again, now I'm going to show the lateral moves to release the spina erecta up the line of the spine, remembering that the leg crank rotates the spinal cord and the spinal column, and how much you move kind of focuses the rotation on different vertebral segments. So when you release, you want to focus it to the area you're working on. So take the slack. Increasing rotation to make sure I get the bit at the top. This was a bit tight here, so I'm going to do this one again. Okay. So remember that when you're doing the laterals, use whatever applicator you want to change the muscle, whether it's the palm of the hand, your thumb, your fingers. Okay? Definitely time to leave after the laterals because it's quite powerful work and you want to give the spina erecta time to respond, but you don't literally, it's the type of gap that I would stay in the room and talk to the client or write some notes on my iPad quickly, just like sort of 2 minutes tops. Just for a point of ease, I'm going to do the QL now while he's in this position, so we don't have to keep flipping you over very well. So, palpating and finding the QL, so we're going to the outside of the spina erecta and the QL is just underneath there. You're looking for those two tightest areas within the muscle, the two kind of trigger point areas. Getting your fingers on both of them, using your middle fingers, and just applying kind of a melting pressure. So you're putting enough pressure in there to change the tissues without pushing too hard and causing him to basically tense up and fight against you because it hurts too much. And then just rest, sink into them and allow the muscles to release. And then slowly come out, don't take them out fast. And it will allow the muscles to stay nice and soft. And we're going to do the other side. Again, QL, if it is primary, can be, you can just do the one side that's primary. If it is primary, it's always on the short leg side, obviously, because it's tight and it attaches to the pelvis and it hoiks the pelvis up. But as I said, usually QL is compensatory. Usually to do with the Psoas. I'm just melting into it. Okay. And then coming out. All right. Have a look. So I'm going to, again, because Will's screening did not show anything in the neck, I'm going to do the coccyx, sacrum work and piriformis work before we turn him over. Okay? If there was anything in the neck would be done first and then we would do this. So short leg is on this side. So I'm going to start with the coccyx procedure. So holding point, long leg side of the sacrum, and then finding the coccyx, and then firm contact pressure so it doesn't move on the short leg side. Then leg drop out to where the whole pelvic bowl rotates, so it's like the biting point. Fixating the sacrum, fixating the coccyx, stretching all the fascia and tissue through there by leg rotation, then increasing it. And that was not good contact, so I'm just going to do it again. Go back and reassess. And that's symmetry, so that's good, so we'd leave it there. However, for a point of reference, I will demonstrate the reverse. So the holding point is still on the long leg side. You hold the coccyx on the same side, still using the short leg as the lever and rotating the same way. So because my body position has changed from pushing away, I would fixate both joints, stretch it, give it a bit of a move. However, I'm not doing it because we've just adjusted his coccyx in the right way. All right? There we go. Back to the middle. There's a depth, it's all good. Right, can we turn you over, please? Thank you very much. All right? Mm-hmm. So, at this point I would hit the lat and do the knee, but that's for the next weekend that we're here. You can all hit the lat now if you want to. So come up to the neck. Using flats of fingers, so you have a big tactile area to palpate, figure out what's going on and where the areas of tension are. And then working on the scalenes, allow my thumb to drop in kind of, well, not kind of, above the traps, going in under the scalenes, coming up over, repeating over all the fibres, noting where the tight ones are and where everything is. So you've got like a tight band around about here, the rest feels pretty good. Same on the other side, up. Okay, now I'm going to work on the middle of the scalene fibres. So I'm just focusing on the tight areas because they're all fine down here, they don't need work on releasing. So I'm just going to do a couple little moves on the tight ones on both sides. Okay, that's fine. Then we'll go to the suboccipital work. Sliding up, so we're just under the occipital bone. Couple of moves that are medial in direction. Middle of the neck, skin slack out, medial move, skin slack out, medial move. It feels fine. If it's tight, feel free to do more on the areas that are tight. Then moving up to the TMJ work or the pterygoid work. So to locate, ask your client, Will, can you open your mouth? Find the condyles, will close your mouth, and then this drop in. That hole it drops into is where the pterygoids are. A little move down towards the couch and down towards the feet. Couch, feet. Then going in under the ears, following the line of the jaw. Very tender, so be careful. Gentle slack up, almost to like underneath the earlobe, and then down along the line of the jaw, underneath both sides. And then to the kind of near the temporalis, where we can access the sphenoid bone. Again, down towards the table, a little slack up, down towards the table, you feel the ligaments there that you're affecting, both sides. Okay? Right. So, psoas and coccyx, yeah? So, psoas, umbilicus is here. Your sort of region of palpation looking for the tension of the psoas is there. Flat of your hand allows you to feel it all. Point of contact and holding point is kind of the bottom ribs on the spina erecti. Look for the tight area. Trigger point. You can often feel it respond in your fingertips up here. Similarly, when you palpate here and find the area of tension in the psoas, I can feel that now in the bottom hand, my holding point. And we just rest and hold and just allow the psoas to release and to give. So remember, push down, check with your client, make sure you're in the right place, see if it hurts. So push down, make firm contact, and then ease off a little bit, and then just gently melt into that tight muscle. And then come on again, come off nice and slowly. Okay? And exactly the same on the other side. Holding point. Palpating. Find the epicenter of tension. Melting in. Allowing it to start releasing. Usually releases in 2 or 3 stages, kind of like softens a bit, and then doesn't seem to move, then softens a bit more, and then you might get a 3rd one. Don't push it. If it's really bad, leave it a couple of minutes, let it all settle, let it release, come back, do it again. Should feel a lot looser, and generally you'll get a response from the client saying it doesn't hurt half as much. Okay, final bits. Pelvic procedure. So, I'm going to start off from the gracilis that runs from here up to the groin. Lift the leg out, let it drop out, kind of stresses it. Pops up where you can quite easily palpate it. Tuck your fingers in so to maintain modesty of your client. So basically I'm resting on the top of the muscle, gentle skin slack underneath it, hooking underneath it, keeping pressure. Stimulating Golgi receptors, feel the muscles start to release, make a move over the top. Straighten the leg. ASIS, bony protuberance here, bottom of that, kind of 1 inch, 2 fingers down, 1 inch, 2 fingers across, it's the line of Sartorius. Again, you want to be perpendicular in your move, so because the muscle comes up here, I'm going to go that way, not that way. So you're kind of like heading up there. Okay, inguinal ligament, bend the knee, stabilise the knee with your hand. Pop your fingers in there. And then as you bring the knee up, it allows your fingers to sink in down, opens it up, you find the inguinal ligament, little move over it, drop the leg down. Exactly the same on this side. Yeah, hooking under, holding, stretching, stimulating the Golgis. Make a move. Go back. ASIS, 2 fingers down, 2 fingers in, sartorius, making sure you're perpendicular. Coming up here. Stabilise your knee, control the knee joint with your hand. Let it go up. There we go. All right.